Hi, everyone, and thanks for joining us. My name is Nancy Pasquale, and I am the Coalition Coordinator for RyeACT Coalition in Rye, New York. And I'm joined today by my colleagues, Dr. Robert DuPont and Dr. Caroline DuPont. And I'll let them introduce themselves, but we're here to present our One Choice for Health, which is a data-informed, youth-driven prevention message that we hope that you will be able to share with your communities.
Hello, I'm Dr. Caroline DuPont. I am a board-certified psychiatrist and addiction medicine doctor. I work at the Institute for Behavior and Health as the vice president, and this is an area of that I'm extremely passionate about, and I'm really hoping that you will be able to use this prevention message in your own work.
And I'm Dr. Robert DuPont, a psychiatrist, a medical doctor. I graduated from medical school in 1962, and 6 years later began my journey in the nation's drug epidemic. And I've been, my career since 1968 has been devoted to the drug issue in America and around the world. In that career, I started a massive drug treatment program in the District of Columbia that was a model for the whole country. And then I became the White House drug czar under two presidents, Presidents Nixon and Ford, and I became the first director of the National Institute on Drug Abuse. And I have been at the center of this issue all through the modern drug epidemic. And what we're doing today is the culmination and one of the happiest times of my 52-year career. So let's set the stage of what we're doing. We're talking about prevention in various settings. What's happened in the past has been prevention has been focused, youth prevention has been focused on individual drugs. Talk about alcohol or opioids or things like that, or settings, don't drink and drive, or specific amounts, don't binge drink. And that is the way prevention has mostly gone. But we want you to think bigger, to have a larger frame when you think about youth drug prevention. Start with the fact that there are no safe drugs for adolescents, no good or safe drugs. And what we're presenting to you now is powerful new research, and a strong new prevention vision to bring to your communities. Now, how does drug addiction happen? It's a combination of brain biology, genetics, and the environment. In youth prevention, we are not going to change brain biology. We can understand it, but we're not going to change it. We're not going to change the genetics. They are what they are. And it's important to realize that some people have more vulnerability to addiction than others, but everybody is vulnerable to some extent, everybody. So what we're talking about is the environment. That's where the changes can be made to make a difference in youth drug prevention. What are drugs? Drugs are chemicals that superstimulate brain reward. It's a complex system that is designed, hardwired into the brain to handle manage behavior, and the prototypes for brain reward are eating, sex, and food and sex. So they're very powerful biology here that we're talking about. And animal studies show that the drugs that people use in a drug abuse setting, the animals will work harder for it than any other rewards. Drug abuse is a pediatric onset disease. 9 out of 10 adults with substance use disorders began drinking, smoking, and using drugs before the age of 18. And the earlier they start using and the heavier they use, the greater the risk of long-term addiction problems.
And I feel like it's important for me to jump in here on this slide, Bob, because I feel like this was sort of as someone who's working sort of boots on the ground in community prevention, this was an aha moment for me when I saw this information presented in this way. Because I think that there are a lot of parents in communities who worry about these bigger problems that they see out in the world, the national conversation, but they don't realize the connection to what their kids are doing in their homes and in the community now, and this larger addiction problem nationally, and addiction problem that we see in communities that's causing devastation and that we're really trying to stop. And so getting parents to focus and to understand, and community leaders to understand that we need to focus on primary prevention with young people, with adolescents, if we want to really make an impact on the addiction problem, both in our individual communities and on the national level.
Absolutely.
So we think about this as being a pediatric onset disease, and that's because of this information. So I know everybody's familiar with this wonderful slides that came out of NIDA that shows the brain development. But I really, when you think about it in this context, these substance use disorders are pediatric onset disease. You can see that the brain is undergoing rapid development all the way through the mid-20s. And so when you look at these slides, it's only the areas of deep purple on those 20, when it says 20, that are really fully developed. So there is a lot of brain development going on all through these years, age 12 through about 25. It's continuing. And this is why this brain is uniquely vulnerable to substance use during this time. So substance use in those early years before the brain is fully developed has a huge impact, not only on that person in that time in their life, but throughout the rest of their life, because this is when that brain is being formed.
The brain develops over time, as you just heard. Beginning in the toddler milestone, the cerebellum, it controls motor movements, and that's what toddlers are all about, being able to move. Then we go to the preschool years, where emotion comes in. Anybody who's seen a preschooler knows that emotion is very highly developed in that period of time. And then we go to the next one, school milestones and academic achievement and motivation. The motivation becomes all important, and that's the nucleus accumbens, another part of the brain that develops even later. And the last part of the brain to develop is the prefrontal cortex that has to do with planning, organizing, and impulse control. This is the normal development during the adolescent years. But they don't develop all at the same time or in the same rate. And this gap that you see in adolescence is the gap between the development of motivation on the one hand and judgment on the other. And that gap is what creates the suction that pulls kids in to addiction when they're using during the adolescent period. Now, this slide takes a minute to look at. Let's just focus on the alcohol. We can look at the others in a few minutes, but just look at the alcohol. What this says is the percentage with what age they started, and what percentage will develop an alcohol use disorder. So just look at 13 and younger, and you'll notice that if a young person starts drinking alcohol in the age of 13 and younger, 47% of those have alcohol use disorders as adults, 47%. If they don't start till 14, it's down to 45. Jump over to 18, and it's 15, and at 21, it's 9. It's not 0, but that's a very steep slope that has to do with the vulnerability of the onset of the use. It's only about onset. Now look at marijuana. If they started at 13, there's 17% are going to have a marijuana use disorder. But jump over to 21, and it's 4%. That's why the age at first use is extremely important. And you see in the final on the right, the opioids, the same thing, where you get 40% at 13 and under, and 15% at 21 and older. So this is the age at first use relates to later risk extremely strongly.
And I think it's really important, again, to think about those brain pictures we just looked about and see how well this correlates with that. So you know, in those younger kids, which on that slide was 12, so about that 13 and younger, there was a lot of brain development still going on. And it does diminish through that early 20s time. But a lot of people say to me, well, you said brain development continues through the mid-20s, and the drinking age, or the age that it becomes legal, is 21. Well, that's true, but you can see that that slope is coming down in terms of vulnerability for developing substance use disorders later in life. So sure, I'd love to have people not use until 25, but getting people to 21 is a great idea in terms of the brain biology.
Right. It's really a game changer. You can see that really clearly. It's a game changer with respect to the likelihood of developing a substance use disorder.
And have everybody think about the fact that what this is about is not first addiction, it's first use. People will often say, well, I'm just using a little. This is about using any at these ages. It's not using heavily at 13, it's any use at 13 does this. Any use at 16 does this. So it's really important that that line between not use and use is very important.
And this slide really shows, again, one of those things, and I think this speaks to, you were sort of edging toward this conversation just a minute ago, Bob, that if we think typically about teens, you know, young people, 13, 14, if that's the place where they're having that first use, typically that is with alcohol. It's the most readily available. It's in most people's homes. It's frequently the easiest to get because for adults it's legal, so access is easy. And what this slide is showing us, and I'm going to see if I can move us over to the side briefly. Nope, apparently I can't without changing the slide, so I'm going to not touch that slide. What this is showing us is that if you talk about all substance use disorders, and the one that people spend a lot of time talking about is this one over here, but among all people with substance use disorders, the biggest one in the US, ages 12 and above, is still alcohol. So this is a really important message for parents, because what I hear in my community often, and in other communities as well, oh, they're just drinking a little beer. It's just a little beer. They're not doing these other bad things. They're just drinking a little beer. And this really shows you how that is the essence of the problem.
So all substance use puts adolescents at risk. An early initiation and continued substance use significantly increases the risk of serious problems. So we were talking about substance use disorders, but it also increases the risk of physical health problems, mental health problems, injury or death from accidents, becoming a victim of violence or sexual assault, lower academic achievement, lower life goals, and high school and college dropout rates. We know the importance of youth prevention. All of us know that. But is there really a clear goal? What we have found is many prevention efforts seem to focus on specific drugs or specific settings or even specific amounts. So for example, there are wonderful prevention messages against not smoking, for example, the Truth Campaign, or prevention efforts about not binge drinking, or prevention efforts about specific settings like not drinking and driving. But what we want to know is what are the core messages for a prevention program? What is considered a drug? What does it mean to be drug-free? What are we really talking about? Are we talking about use, misuse, overdose, addiction? And what do we mean by youth when we say youth shouldn't use drugs? Defining these things becomes really important when you're formulating a powerful prevention message. we're talking about a new vision as a clear prevention message, which we call one choice. One choice whether to use or not to use. We're talking about no use of any alcohol, nicotine, marijuana, or other drugs for reasons of health under the age of 21. We really want to make sure that it's very clear what we mean. We mean no use of any of these substances, and we're being very clear about that age because of the science that we've just showed you.
Okay, what are some of the consequences of being substance specific, and why not do that as opposed to what we're talking about, which is put them all together and emphasize the choice of using or not using altogether. Now, what we're going to show you now is very powerful new data. So I want you really to focus on this. This comes from the national survey called the Monitoring the Future. That is the way the nation keeps, not Monitoring the Future, and the National Drug Use and Health Survey. This is the way the nation keeps track of use of all ages. And we're focusing here just on the 12 to 17-year-olds. And this is from a sample from 2014 of 17,000 American youths randomly selected and looked at. And we're focusing on the question of, is the use of one substance associated with increased use of other substance, regardless of the sequence? We're not talking about one leading to another, but that they are linked to each other. And we're going to look at that data with new eyes and have a new understanding of the problem. Next slide.
I think it's important, actually, before we move to the next slide, to just point out, Bob, your personal role in the fact that the nation looks at this data in this way. So I think it's important for anybody listening to understand. You spoke a little bit about jobs you've done in the past and that role, those roles that you had at NIDA and as a White House drug czar, and really this idea of collecting data on a national level in order to make decisions about prevention that were driven by science and driven by data was really something that you were at the very forefront of. And I think it's important for people listening to know that.
I was absolutely in the White House when these were developed, and also as the first director of the National Institute on Drug Abuse.
Right.
And I'm very proud of the fact that was when the country was first dealing with the beginnings of the drug epidemic. And the biggest problem we had no data to show what was really going on.
Right.
And these two studies, this one is the National Survey and the other is the Monitoring the Future, are the way the country studies drug use, particularly youth use.
Right.
And I'm, as Nancy says, extremely proud the fact that Monitoring the Future study in particular was one that I initiated when I was in the White House.
Right.
Okay, we're going to spend a minute just looking at this one side. We're going to see a lot more, but I want you to just focus on what we're looking at here. On the left side is Americans 12 to 17, or early adolescents, not the later ones, 12 to 17. And on the left side is those people from 12 to 17, male and female, who did not use any marijuana in that month. So this side is all did not use any marijuana. And the other side on the right is people who used any marijuana, even one puff in the month. That we're going to look at them. And we're going to look at what happened to their use of alcohol. What about binge alcohol use? That is 5 or more drinks in a row. Heavy alcohol use, doing that more than once in the course of the month. Cigarette use and other illicit drugs. Now, what you'll see on the right is, let's just take a look. Let's go to the next slide. It'll focus on it. I think will get us to that. We're going to look first about alcohol. You'll notice that if they did not use any marijuana in the last month, 8% used any alcohol. That means 92% of the young people who did not use any marijuana that month did use alcohol. Now, if they used any marijuana in the last month, any marijuana, it's 44.6%. It's 5.6 times more likely that they used alcohol if they used any marijuana in the prior month. Now we're going to look at binge alcohol use. If they did not use any marijuana, 3.5% had in that month any binge drinking. But if they did use marijuana in the past months, it's 27.5%, 7 times more likely. Now you'll see slides compare data comparing one with another, and they'll do a statistical study to say whether they're significantly different. If 27 is significantly different than 32%, we're not talking about that. We're talking here 7.9 times more likely. You don't have to do a statistical study to see that that's significant. Next one. Now we're going to look at heavy alcohol use. Heavy alcohol use is repeated binge drinking in the prior month. Only 4.4% of marijuana use, but of the people who used any marijuana, it's 5.9. It's 15.9 times more likely just from using any marijuana. Okay. Now we're going to look at cigarettes. 2.7 of these young people who didn't have any marijuana use, and 23.6%, 8.9 times more for cigarette use. And then the last category is other illicit drugs. This includes the opioids, 2.2% versus 21.7, 9.9 times. That is a powerful correlation, and it all rests on one difference. In the past month, did they use any marijuana or did they not?
And this next set of slides is similarly laid out and talks about the fact that this same association can be seen when we ask the question, did you use alcohol in the past month or did you not? Now, I am going to note that this particular set of slides shows, because we talk about alcohol in terms of some use and binge drinking and heavy use, but the slides are arranged in the same way. So you can see on the left that if a young person aged 12 to 17 said that they had no past month alcohol use, their likelihood of using marijuana, if they've said no past month alcohol use, is 3.5%. If they had some use, it's 20%. If they binge drink, it's 34.3%. And if they have heavy alcohol use, consistent binge drinking over the course of a month, their use of marijuana increases to 54%. So I want to just mention earlier, there was a slide where we talked about the fact that the age of onset, but also the amount of use has an impact on later use. And I think this is one of those places where you can see that. It's about the age of onset, but it's also about the amount of using. The amount of use is staggering, and the amount of use increases that likelihood of use of other drugs here. You can see that clearly. So they are 5.8 times more likely to use marijuana if they have some alcohol use, 9.9 times more likely to use marijuana if they binge drink, and 15.7 times more likely to use marijuana if they engage in heavy alcohol use. The same is true for likelihood to use other illicit drugs. If they've indicated no past month alcohol use, no use at all, only 2.2% of those young people are saying that they've engaged in the use of other illicit drugs. That jumps by a magnitude of 4.8 times more likely to 10.5% if they have any alcohol use. It increases 7.6 times if they've indicated that they engage in binge drinking, and they're 16.8 times more likely to use other illicit drugs. And the only difference there is if they've said they've engaged in that heavy alcohol use or binge drinking or some alcohol use. The same is true for cigarettes. You can see over here, if they say no past month alcohol use, only 2.5% are saying that they've engaged in the use of cigarettes. And Caroline is going to speak briefly shortly about how that use of cigarettes is changing now. Because really what we're talking about here is nicotine, right? So they're 3.8 times more likely if they've said they've used some alcohol to use cigarettes. They're 8.1 times more likely to use cigarettes if they engage in binge drinking, and 13.4 times more likely to use cigarettes if they engage in heavy alcohol use.
So as Nancy said, I'm now going to talk about the association also being true for cigarettes. Now, I would like this to say nicotine, but the study was done with using the question to the kids about cigarettes. But we're going to talk a little bit about what that means in terms of nicotine use, in terms of vaping. So we'll get to that, don't worry. So you'll now recognize this slide. You're very accustomed now to looking at these slides. And one of the things we love about these slides is they're so visually clear. So once you learn what this slide means, you can really get this. Oh, wow, these are big differences that we're talking about. So again, 12 to 17-year-olds, no past month use of cigarettes, and yes, past month use of cigarettes. Okay, so we're just dividing it in the same way we've been doing it. And you can see that alcohol use has gone up 4.2 times more likely to be using alcohol if they said yes to any cigarette use. Again, one cigarette would count as cigarette use in this situation. And if you go to binge drinking, again, it's much higher, 6.1 much more likely to be to be binge drinking. And heavy alcohol use is 10.4 times more likely. I want to just point out that those of us that work with youth know that binge drinking and heavy alcohol use are extremely common in this population of the kids that do use. So sometimes it's tempting to kind of discount those and think, oh, those are lower numbers. But in fact, it represents a lot of people, and a lot of people who are at high risk in this group. Right. So, okay, then marijuana use, look at this with the association. So people who have not smoked any cigarettes in the past month are quite unlikely to use marijuana. And people who have smoked cigarettes in the past month are 7 times more likely to have used marijuana. And again, these are 12 to 17-year-olds. And then look at this jump in other illicit drugs. This one is really, to me, this is one of the more significant ones. So from 2.7 to 20.7 for other illicit drugs. And that's pretty scary when you think about what that means. So if we go to this next slide, you're going to see it. Oh, well, okay, sorry. I want to point out that what we're pointing out with this data, this is our data that we've just shown you. And we are extremely proud of these slides because they're so visually clear on the association. And what we're showing is that there's a generalized risk for substances consumed by use based by any use of the 3 most common drugs, alcohol, cigarettes, and marijuana. And it underscores the importance of screening for any substance use. So if a person reports positive substance use, if an adolescent reports positive substance use in any of these categories, you know you need to be screening for those other substances. Because you know if they're saying, yeah, I smoke some pot, or I vape some nicotine, you know you need to be looking for those other things based on those graphs that we just saw. And it underscores the need for that clear youth prevention message of no use of any of these things, because any use is associated with other use.
So I'm just going to jump in here real quickly, just as a reminder to any parents and coalition folks who may be watching, that this is the place where we have to have the most clear message when we're speaking with parents, because And when we're speaking with policymakers, to be honest, because there is a perception, especially around alcohol, and now there is a growing perception with the legalization of marijuana. Oh, it's just a little pot. Oh, they're just drinking a little beer, and as long as they're not doing those other bad things, we don't have to worry. And I think that what that last set of slides and this slide sort of summarizes is we do. If they're using any of those three things, alcohol, cigarettes, nicotine, marijuana, we need to be worried about all of those. We need to be worried about other substance use, because it's very clear that they're correlated.
So this is the slide I was jumping in to try to get to. So this, you can see it's set up in the same way that the slides that we just showed you, but this is not our data. This is data from Colorado high school students in 2017 in their Healthy Kids Colorado survey. But you can see the exact same thing. So these are high school students, and we have no past month nicotine vaping. And then we have yes, past month nicotine vaping. And it again, as Bob said, it doesn't take a statistical analysis to see what a big jump that is. So for those kids that are vaping at all, once they have made that choice to be vaping, their risk of other things, so this is that blue line is binge drinking in the past month. Look at that jump in binge drinking for kids that say yes, that they have done any nicotine vaping in the past month. That is a huge jump. And then the green line is marijuana past use, again, significantly higher, and non-medical prescription pain medicine. Look at this jump. That is scary. And again, this goes with what Nancy was just saying about the fact that especially, I think not so much anymore, but early on in the vaping, a lot of parents were very complacent about it. They really didn't think it was risky, and they thought it was so much safer than cigarette use. And I think they thought it was kind of like a little bit of a trend that was just going to be a flash in the pan. And they didn't realize what the significance was of that kid doing that vaping in their high school or even younger ages.
Okay, what we have shown is the linkage of all the drugs, and you notice the three drugs that are in adolescence that dominate the picture are alcohol, nicotine, and marijuana. Those are three gateway drugs. That's the issue with kids, is the use of those drugs and the normalization, particularly, as Nancy said, of the use by adolescents, including adolescents, of alcohol and nicotine. I mean, alcohol and marijuana is very striking. Now we're going to shift gears to look at the question of, okay, we're talking about the goal for prevention of no use. Is that realistic? So we're going to look at a whole new set of data, this one from Monitoring the Future, that's going to look at that question of, is it realistic? Okay. Now, just look at the lifetime use on the left-hand side. And what you see, and look at the bottom line, which is 12th graders, the solid line that you see there. That goes from 1975 to 2015. And the question, that shows the percentage of American 12th graders all over the country, national sample, nationally representative sample, large sample, of did they in their lifetime have no use of any alcohol, any cigarettes, any marijuana or other drugs. And the low point was 1983 at 3%. In other words, in 1983, 97% of high school seniors had used some drug in their lifetime. Now, go up to 2015, and it's 26%. And look at the steady slope that is there over that period of time. That is stunning. Until our research, no one had ever seen that graph. No one had ever seen it. Nobody knew about this incredible growth of the 12th graders who were not using other drugs. Now look at, stay on the left side with me for a moment here, and you'll see the line up above that with the heavier darker dotting there is 10th graders. And above that are 8th graders. And you'll see that those are higher percentages who have not used, but exactly the same slope. So it isn't just high school seniors, it's all of them are on that slope. That means that the high school experience of drug use has changed dramatically over that 30-year period, more than 30 years. It's a very dramatic change. Okay, now we're going to go to the right side, and we're going to look at past month use. So this says, in the past month, have you not used any alcohol, any cigarettes, any marijuana or other drugs? And again, in 1983, this time it's 16% in the last month have not used. It's much bigger because this is just the last month. But in 2015, it's 52%, exactly the same slope. And you see that same slope in the 10th graders and the 8th graders.
So I want to just jump in to say again, because this is one of those things that we hear all the time, where parents and sometimes even young people will say, everybody uses. And this is a really great slide to be able to say with data and information that is a nationally representative sample, that in fact is not the truth. And what I think is amazing in my experience of working with kids is that these kids and a lot of our message, and we're guilty of it, even those of us who are working really hard to get good prevention information out there, are guilty of rendering these kids invisible. And what this does is it brings them out into the light and says, nope, there's a lot of you out there. Let's make that the story.
And as Nancy says, a lot of the parents were in high school in the era when it was 3%. And so they assume that's the way it is now. They don't know that there's this big group out there. So the question about our data was, hey, folks, you're talking about 2015. This is 2020. What's going on now? So we just completed, and it's now been submitted for publication, look at what's happened between 2015 and 2019. So a 4-year period of time. And you'll see that for each of these drugs, substances, the alcohol use, you notice the percentage who not used alcohol has gone up from 34 to 41 here on to look at that. And in terms of the lifetime use and in terms of the past month, it's gone up from 62 to 70.7. Now that's very important in that 4-year period. Look at those alcohol numbers, the red ones, but for both the past month and lifetime. See the direction it's going. And you'll notice the cigarettes, it's even more so. In that 4-year period of time, the percent had not used in their lifetime had gone up from 65 to 78, and in the past month from 86 to 94. Those are tremendous trends are continuing. But now look at marijuana. It doesn't show the same trend. And you see there that the percentage, if you look at the start with the lifetime, it does go up, but just very small, much smaller than alcohol and cigarettes. And if you go over and look at the last 30 days, it's actually down. And that's because marijuana is on a different trend because of legalization of marijuana, and it's stabilized in that. But then look at the yellow and the orange. This is what this slide is about, is the yellow and the orange. Okay, that's the percentage who have not used, first of all, on the left side, in their lifetime. It went from 25.7 to 30.3. We went over 30% in that 4 years in lifetime. And look at this on the right side. The percentage went from 51.5 to 56.3, a 5% jump in this. So somebody says, okay, that's an old trend. Is it not now? Hey, folks, it's now. It's continuing right now. And those are tremendous numbers, 30.3% in their lifetime who've never used anything, and 56.3 and used nothing in the last month. Those are very positive numbers. This is a large percentage of young people who've made this choice.
I just have to say, this always I find so exciting to see, and something that people just don't get. 30% of high school seniors in their lifetime have never used any of these substances. We really have to celebrate that, and we have to support those kids who are making these smart life decisions And I'm not going to discount those kids on the other side, the ones that have not used in the past month. I mean, that is really showing that a lot of high school students are making smart choices about their health. And that is something, again, we really want to support and encourage and recognize.
Right, right. And this leads me to that question about the who can make one choice. And I think the answer is clear, that we see in those, and I'm just going to pop back to this prior one for a second, to say the number of people making the choice not to use any substance in each case is higher in the past 30 days. And what I would say is that's actually great news, because it means at any given moment, at any given time, on any given day, anyone can make a different choice, and that number can keep growing. And the more we grow this number, the more eventually this number will grow. The more we grow past 30-day non-use, the more eventually we will grow lifetime non-use. And so it's really important to not discount the kid who maybe did something yesterday or last week or last month that was not the best health choice, but that we encourage them when they start to make a better one. And I think that for a lot of folks who work with young people are familiar with this idea of the growth mindset, that it's even if I've made a different choice before, every single day is an opportunity to make a better one. I can get more information, I can learn more, and as a parent, I can send a different message that says, I'm worried about what you did before, but I'm glad you were making this choice now. Let's keep that going. Let's keep that going forward. So it can be teens who have used in the past. It can be teens who have never used the substance. It can be individuals who are actively in early or long-term recovery. And I think that that's really important to just make sure that that's clear, that one choice isn't about a hard line, that if you ever used before, you can't be part of this conversation and this movement and making this choice now, because it's absolutely positively not true. And I think it's important to also talk about that we see that there's universal support for clear messages around teen health in other areas. And some great examples of that are always wear a seatbelt. So again, I'm going to say, when I was a young person, seatbelts didn't even exist in some cars, and they certainly didn't exist in back seats of cars where children sat. But now we wouldn't even think about not having our children. As a parent now, I wouldn't even think about not having my child in a proper, wearing a seatbelt all the time, every time, and being in a proper child seat. So that's a great example of how a public health message helped change the way we think from how things were when we were young to how things are now. And for parents of teenagers right now, many of whom, like Caroline and myself, are fall in that, sort of 1980s lowest place on that, use lifetime no use or past 30-day no use. This is a really important, we've been able to change our mind about seatbelts. We've been able to change our mind about bicycle helmets. We've been able to change our mind about sugary drinks and eating a healthy diet. So this is just one more example, and exercising regularly, where this message about prevention of substance use and no use is on a continuum of just best practice in parenting. And we have the ability to change how we think about that, just like we have done for all of these other public health messages. And Bob, this is you, I think.
Yeah, that is. That's right. Our message, what we're proposing, and we encourage you to adopt, is the no use stance as a clear health standard. The alternative view that has been dominant and still is widespread is that experimentation, that's the word, with drugs and alcohol and marijuana is seen as not only inevitable, but as part of adolescents' learning. Adolescents learn from their experience, and they'll make their own decisions. And so we normalize that. I want to just focus on that concept of experimenting and go back to what Nancy was talking about seatbelts. And let's think about if we use that approach to seatbelts, where we said, look, kids experiment. They're going to experiment. They're going to experiment for themselves about wearing seatbelts. Is it smart to wear a seatbelt? Do I need to wear a seatbelt? And if the kids experiment with it, they're going to find they don't, because they don't have an accident. They don't have anything happen to them. Their friends don't have anything happen to them. They would logically conclude it doesn't matter. I can do not wear seatbelts just fine. Now, if we said that to parents and said, okay, what do you think about experimenting with wearing seatbelts? They'd say, that's crazy. But that's what they normalize. The parents do, and the adults do, the teachers do, experimenting with drugs. And what the kids find with drugs is that they use drugs and nothing bad happens to them. And their friends use drugs and nothing bad happens to them. It's exactly the same, where it's a percentage of those people who have terrible consequences, and we decide that that behavior is dangerous and to be discouraged. But that thinking of the normalization of experimentation is exactly what we are after changing and turning it like seatbelts. It's not healthy for kids to not wear seatbelts, and it's not healthy for kids to use drugs. It's also very important that all teenage drug use is illegal. Vaping is illegal. Cigarettes are illegal. Alcohol is illegal. Marijuana is illegal in the legal states for teenagers. That's for health reasons. It's not for no reason that they're illegal. It's to protect adolescents. It's also interesting that the commercial industries in these areas all, at least nominally and officially, discourage underage use because they know that's their vulnerability. So when you talk about, we can disagree about a lot of things about drugs, but when it comes to kids using drugs, where's the disagreement? Who thinks it's a good idea? Not the industries. The legality is clear. This is not a complicated question for us to deal with, but it's important to realize that we have for decades treated drugs in a different way from other health behavior, and to the detriment of America's young people.
Right.
Okay, now we're going to go into a new set of slides. We're going to shift gears here a little bit. This is just one slide looked at it in a number of ways, but it's very important to learn lessons from a national history of substance use. So let's get to this first slide. We're going to look at this in detail, so you'll get a chance to sort of digest this in the next few slides. But just focus with me now on the alcohol number. Now, this is that's the red one, and it's a very simple slide. It goes back to 1975. This is what I talked about, the Monitoring the Future study, and it goes up to 2018. And it looks at this, this slide is a very simple question. In the past month, has this high school senior used any alcohol or not? And you'll see it peaked out at about 73% in about 1978. Okay, in 1978, 73% of high school seniors had used alcohol in the last month. Look what that line looks like. I don't think there's virtually a parent in the country who knows about that line to look at that. It's down to 30%. And it's a steady line going down over that period of time. That is hugely important. Now to look at something entirely different, look at cigarettes. And you'll see that's going down. They all peak at the same time in 78, which is very interesting. And it goes down. It was level, and then the bottom fell out. You see how about 1997, cigarettes, boom, they just fell out at that point. That is when the tobacco settlement happened and the Truth Campaign started, and they did a terrific job on cigarettes. It's very dramatic. Now look at the green one. This is marijuana, and we're going to spend more time on this. But you'll see it peaked at the same time, and it went dramatically down, and then it hit a bottom. What happened? We're going to look at that in the next slide. We'll get into that, but you'll notice that I want you to notice right here that in about 2008, marijuana passed cigarettes, and if you look out where these turns are going, the green and the red are going, marijuana is on a trajectory to pass alcohol in a few years in terms of use there. Okay, go to the next one. Now we're going to look at a little bit more detail. What happened? Why did we see such a dramatic drop in marijuana use? If you look at 78, what the percentage was, and then 92, that's a 62% drop that went on in that period of time. 62% drop in marijuana use at that time. That was what was called the parents' movement. And it had very widespread, absolutely bipartisan support. The media was fully engaged in support of that at that period of time. There was no ambiguity about it, and it went down. But, go to the next slide. The world changed with the marijuana legalization movement. During that period of time, marijuana legalization as a political idea was absolutely dead. Absolutely dead. There was no meaningful support for it. But it became very widely supported starting in 1992. And you'll see what happened as a result of that. But it's surprising to a lot of people. It wasn't as if then all kids started using marijuana. But what happened, the downward slope was gone and it went up, but it's more or less been a level throughout all this marijuana legalization. It has not boomed up, but it has resisted the trend of both cigarettes and alcohol. And it's a very different trajectory. And that different trajectory is a result of the normalization and the definition of marijuana use as safe and harmless. So it's clearly different, but it's very understandable. But the main takeaway I want you to take away from this is this downward trend in all of these numbers. Even in marijuana, we're now at about half what we were in 1978. That was when I left the government in the National Institute on Drug Abuse, and I was appalled to find that 1 in 9 high school seniors in America in 1978 smoked marijuana every day. 1 in 9. Today, that number is about 6%. We're worried about it, but it's half of what it was in 1978. Now they're smoking a lot heavier, more different marijuana, so it's the health problems of that. But just the numbers, I don't think people have awareness of how different that is and how important and how positive it is.
Well, and the other thing that I would share, and just I'm going to go back here for 1 second, Bob, is to say that it is to just have parents acknowledge and understand that that was about them mobilizing. Yes. And I say that because I feel, as a parent of teenagers myself, and as a coalition leader who talks to a lot of parents often, there is some time, parenting is hard work, man. Like, it's the big secret. It's really hard. And especially in the teen years, it's very challenging. And it can feel extremely overwhelming for parents. And I feel like what's really great that this slide shows is that what you do and what you say as a parent and the impact that you can make on this critically important public health issue and this personal health issue for your own children, don't underestimate the power that you have to make an impact, and especially when we do that collectively. So I just want to say that, like, for anybody who might be listening who's a parent, like, don't underestimate the power of that, because it's real.
It also, Nancy, to pick out of this slide, is it shows that drug use is not immutable. It very much changes.
Correct.
Back to the slide where we started about the environment. The environment changes and the behavior changes. It is not fixed. It's very changeable. Right. And there's lots of reasons to be optimistic about it.
Right, right.
So coming back to our one choice message, it's really important to understand that this is a health issue. Youth substance is about health. This is not a moral issue. It's not a judgment call. It's not adults telling kids what to do. This has to do with a standard of health that's supported by science and by data and by the understanding of the developing brain. Our one choice message is not a prevention program. It's a message that supports all other prevention efforts. It's something that can be incorporated into every prevention program. even if that prevention program is a substance specific, for example,
Right.
PrEP program, it still can incorporate this messaging into that prevention program.
And I think that's really important just to note for any folks who might be listening who are involved in like the DFC program, for example, which is a big support system for community coalitions, and where there is a lot of emphasis on understanding on a drug by drug, very specific basis, and having very specific strategies for each drug and its specific use. I think it's just important to point out that this doesn't undermine that, it supports it. It can be a foundational support that flows through all messages.
Yeah, thank you. I think that is essential to understand. And the other thing that's really important is that this promotes teen self-care and autonomy. This gives the teens the information they need to continue to make their smart choices. Remember, 30% of high school seniors have never in their lifetime used anything. A lot of times, not only do adults not know that, but the teens don't know it.
That's right.
And giving them this information, letting them know this is a valid choice that a lot of smart teens are making, is extremely powerful information.
Yeah.
And it is a wonderful opportunity to develop teen leadership. When you give that information to the teens and let them bring it to their peers,
Right.
that's when you really get traction with this fantastic message.
Yeah.
So I just want to point out that there are other people supporting this message, and that, again, One Choice is compatible with the national prevention efforts. Excuse me. So the Academy of Pediatrics clearly supports a no-use prevention goal, and also the Department of the Surgeon General. So this is Jerome Adams, our current Surgeon General, shown here with Dr. DuPont. So this is very exciting. But this has to do with the fact that he has had a very strong message on no use by youth. And specifically, he articulated the no use of marijuana by youth in a very powerful way. And also, our messaging is easily incorporated into SBIRT, which is the brief screening, brief intervention, and referral to treatment that is used throughout healthcare providers at all levels. And the One Choice messaging is really important in terms of informing that process as well.
Right. So again, a note to prevention folks in communities and coalition leaders in communities or coalition members. This is a great opportunity to share this information and to enhance those partnerships with medical providers, especially I would say pediatricians, because that idea of that if you screen, don't just screen for all, screen for one, and if you hear about use of one, you should be screening for use of all substances. So it's a really important message to bring to that particular sector as we're doing that work across sectors in our communities.
If we go back to that for 1 second, I just want to point out another thing that we alluded to before, but sometimes the adults are your hardest sell. And that's whether the adults are parents or the adults are pediatricians.
Or teachers.
Right, because they grew up during that era when substance use was, frankly, more ubiquitous during the high school years.
Right.
And so letting them know that it's not that way anymore is really important, because otherwise they're going to be like, I used it, it was okay, and I'm fine now. And they're not really understanding how much things have changed, both in terms of the large number of kids that are not using now, and also, as Bob mentioned, in terms of the fact that the products are not the same. So the marijuana today is not the same as the marijuana in the past, and it certainly is being used in a huge number of different ways and by a lot of different delivery methods and products that are being marketed. So I think understanding that there really are changes and focusing on what that adult that you are talking about needs to understand the situation today.
Well, and I think just to add on to that, the other thing that has changed dramatically is technology. Our ability to understand what's happening in the brain and to look at what's happening with brain development, that didn't exist when I was a young person and when I was a teen, and when most people practicing today were teens, or many teachers were teens or young people. Our understanding and knowledge, because of changes in technology and our incredible ability to understand what's happening in the brain and how it works, paired with our ability to look at data that has now been collected over a long period of time to show trends across large populations, that the pairing of those two pieces of information that have enabled us to have a clearer and better understanding than we were able to have back at that time is really just critical. It changes the game. And so this is the place, again, and Caroline, you were alluding to this, that adult stewardship is important because they're often the hardest folks to convince. And what I find in my work, and I work a lot with young people in our community and in other communities, is that teens have no trouble with the one choice message. They have no difficulty at all getting their heads around the idea of a one choice message. Although even for teens, I do think the most important thing is getting them to see that they're not alone. That there are so many of them, not just in their own community, but nationally, who are making this choice, this healthier choice to remain, to not use any substance. Because again, adults often perpetuate this concept of cool kids are the ones who are using. And that's a place where we can actually, our teens can have a tremendous impact on their thinking, because we can shine a light on these teens and show how cool they are, and the things that they're doing and the leadership role that they're taking in trying to promote the health of their own peers and take responsibility for their own health in really incredible ways. So I'm going to talk just a little bit about RyeACT's One Choice story. So we got involved with One Choice back when we were first starting as a coalition, because I heard Bob speak at a national conference. And I heard him speak about this idea before it had a name and a brand as One Choice, but he was talking about this very data that we're looking at now. A few years back in 2017, and our coalition was a pretty new coalition at that time. It was in its very first year of the DFC program. We were really new, and our community had experienced a lot of loss. We had lost at that time, excuse me, 6 young people in a period of less than 2 years. And most of those were to opioid or heroin overdose. And so, as you would imagine, people wanted to talk about this. They wanted to talk about opioids. But you can see from these bar graphs that show our survey data around substance use that even in Rye, where we had a lot of loss related to opioids, that this alcohol, marijuana, e-cigs, and cigarettes were where use was happening for teens. And so when I heard Bob talk, all I could think of is, you need to come to my community tomorrow, like tomorrow, because we're that story. This story is us, and our community needs to hear that message. And we have since that time had a really broad integration of our One Choice message across a variety of programs throughout. From the very beginning, we have implemented and gone with this idea, and we had to work on that. We had to push hard. We had to push hard to dispel misunderstanding and a lack of understanding, mostly in the adult community, among policymakers, among parents, around again this thing that we've been talking about of, is it practical to consider a no use message as a practical message? And what has happened as a result of that long integration in every place, in every way of no use as the health goal, is that we've seen dramatic decreases in use. So from 2014, when we did our very first sort of baseline data set to November of 2018, which was our most recent one, we saw a 42% decrease in past month alcohol use for 8th graders, a 39% decrease for 9th graders, a 10% decrease for 12th graders, where use is typically highest. We even there, we're seeing dramatic decreases. And I would point out that these decreases, these very high percentage decreases in 8th and 9th grade is terrific news, because again, as we know from that earlier slide, the earlier the age of onset, the more likely the problems. So this is great news in terms of that pushing off that first use. The same is true for 7th and 8th graders for past month binge drinking, a 59% decrease from 2014 to 2018, and a 10% decrease in binge drinking among 11th and 12th graders in that same span of time. And we know, again, the more the use, the heavier the use, and binge drinking being a particularly dangerous type of use, these are just amazing results that we're so proud of. The same is true. We're seeing a downward trend in marijuana use. Again, 53% in 8th grade, 65% decrease in our 9th graders, and a 21% decrease. This is between 2014 and 2018. And I do think it's worth noting that we saw these decreases in the face of, in New York State, where I am, a recreational legalization movement. Medical marijuana, or what they call medical use of marijuana. So I debate that term, and I know Bob and Caroline do as well. But that was legalized in this time period, and there's an ongoing debate around legalization for recreational use. So the fact that these numbers, in the face of all of that, have gone down is really a testament to something special that is happening. And I think that no use message is helping to propel that for us. And then the same is true across almost every grade for non-medical prescription drug use. And this was an important one to be able to show in our community, because that non-medical prescription drug use was a part of what drove those losses. So this, showing this was a terrific thing to be able to talk about in our community. And this is just showing that in sort of the opposite way. This is overall reports of no past month use for alcohol increased for all 9th through 12th graders by 5%. 5% more kids in high school in our community said that they had no past month use of alcohol. 6% more, a 6% increase in those reports for marijuana. So those are tremendous results for us. And I would say that one of the things that that really propelled that forward was that we got our youth involved in carrying the message, and we got our youth engaged in talking about their own non-use. So one of our students, back when we had Bob come and talk to us in 2017, one of the things that he did after he did a big presentation for parents and community leaders was that he came in and met with some of our student leaders. And at that time, our RyeACT student youth group had 5 kids in it. But he came and he had breakfast and he talked to those kids. And the biggest and most important takeaway that they took was that they needed to get out among their peers and talk about their own non-use, and that I needed to help give them a platform and a megaphone for doing that. And I credit their willingness and their hearing those words from Bob. It was their big message from Bob. Go talk about it with your peers. Go tell them about what you're doing. I credit them more than almost anything else with what has been happening in our community. And so this is where I would say to coalition leaders and folks who make public policy in communities that your investment in engaging youth in primary prevention, I can't say enough how much of a payoff there will be in that investment. And the way to make that investment is to provide those youth with general youth leadership development, but also specific prevention-specific youth leadership development training. Focus on what matters to them and make that connection, and then make what matters to them connect with with prevention. Make them sort of the drivers, and allocate, and how you do that is to allocate resources, people resources, time, your time, and money, budget resources, funds to help support that training for them, because they are in fact, like doing this primary prevention work with them is really sort of project-based learning at its best. Because these kids in this generation are so deeply interested in connecting with their peers, in making a difference in the world they live in really meaningful ways. And this is a great opportunity to pick up on that and give them a platform for it that is helpful both for them and for the peers that they are addressing their message to. And one of the ways, the big way that we carried the one choice message forward, and really once it was branded as a one choice message, was that we engaged in this I Am One campaign, where we asked teens who haven't used to talk about their reasons for not using. And our youth leaders were inspired to do this. We brought them, talking about giving them prevention leadership training. We brought them to this national conference, this CADCA national conference. And when we were there, we visited the monuments, because you don't go to DC and for a conference and not visit the monuments. And they were really struck in a very powerful way by both the Vietnam Memorial and the World War II Memorial, in terms of their sort of monolithic, powerful impact as messages. And we talked about the fact that one was sort of a message of sadness and of being engulfed in sadness. And one was really more a message of being engulfed in this joyful, jubilant sense of collective overcoming of something evil and bad that was taking over. And they loved the idea of making a sort of monolithic statement to share their individual stories. And so we decided to do these I Am one choice tiles, because often we find that there are youth leaders that are very interested in, who work with us directly, who find it easy to say, I'm drug-free and this is why. And they're willing to put their name on it and their face on it. But for some, they want to be able to identify that with that, but they want to be able to do it in a way that is just a little more anonymous. And so we did a little bit of both. We had a message that we're going to share with you shortly, where youth leaders got in front of a camera and talked about their reasons for making that choice. And we also gave any kid who wanted to the opportunity to say, I'm one of those too. I'm one. I make that choice. This campaign started and the kids thought, oh, maybe we'll get 50 or 100 tiles. Within a month of starting this campaign, we had over 200 tiles from kids of all ages, but primarily high school students. We rolled that out and we brought this massive mosaic wall to our high school and added an additional 70 tiles. We brought it to our middle school. This wall now has over 800 individual tiles in a school district where there are about 1,600 youth in grades 6 through 12. more than half of them were willing to contribute to this message. And seeing it, it literally overwhelms you. It's this massive wall, and it's enormous. And so it helps the one kid recognize that they may be one, but they're one of this big one that is a collective, powerful message. We also made sure that we found ways to connect our teens with other teens, other clubs, groups, sports groups, kids who are doing plays, kids who are doing leadership in leadership groups among, that are not necessarily choosing to be in our group, but that are doing youth leadership in other ways. And that's part of how we got this campaign to grow in such a meaningful way. And we now are doing that, connecting beyond just our individual community out into our county and now out nationally. And we invite your youth to join us in that message. And so we're going to share, I'm going to briefly stop my screen share and ask Caroline to pull up our I Am One video. So Caroline, you can share.
Many young people feel like the only one when they make the healthy decision not to use alcohol, nicotine, and other drugs. The truth is, most Rye youth do not use substances, and that number is growing every day.
I am one. I make one choice because I want to be healthy and happy, and I want people to know that it's okay to not want to drink or do drugs because everyone else is doing it. I want people to know that you don't have to feel pressured into doing something you don't want to do just because everyone else is doing it.
I am one. I choose to be drug-free because I am a student and I'm an athlete and I want to keep my body healthy for as long as possible.
I am one. I don't do drugs because I want to feel like I'm in control and I want to be able to make my own choices.
I am one, and I make the choice to be drug-free because I'm an athlete and I want to keep my body healthy.
I am one. I make one choice to avoid drugs and alcohol to pursue a childhood dream. Growing up in a basketball family, I had a lot of role models that were great basketball players and hardworking people. From then on, I decided that I wanted to play Division I basketball. My priority was to become a hardworking, successful Division I athlete, and I avoid drugs and alcohol to maximize my athletic ability and to optimize all the opportunities that I have. I am one. I make one choice to be drug-free because I don't desire to put them in my body.
I am one. I make one choice to be drug-free because I want to be a role model to my younger sister and to my teens.
I am one. I make one choice because I don't want to be controlled by anything.
I am one, and I make one choice to be drug-free because I have a goal to pursue neuroscience and neurosurgery, and that's something that really interests me. And making sure that I'm staying off of drugs is important in making sound decisions for myself and in the future for others, hopefully maybe patients. So it's important that I keep my mind where it needs to be in order to reach my goals.
I know in making the choice to be drug-free, you can feel alone.
But we want you to know that you are not alone.
Because I am one.
And I am one.
And I am one.
And I am one. And I am one. And I am one. And I am one. Let's make one choice together.
So that video, I just am overwhelmed every time I see it, at these incredible kids who are just brave and fearless, and they're different. Their reasons for wanting to make that choice are different and personal. But I'm so grateful to them every day to get the chance to work with them. They are just an inspiration, and just so that you know, that video was unscripted. So all we did was ask those teens, what is your reason why? Why do you make the one choice to be drug-free? And then the rest was just them speaking from the heart about their personal experience. And what we hope is that between that video and this enormous mosaic wall that shares all sorts of different reasons, and the reasons, sometimes when you read kids' reasons why, they just make you chuckle, you know, my mom doesn't like drugs, or I want to make my mom proud, or because my teacher told me, you know, my health teacher told me it's a bad idea, and I want to make him proud or her proud. Because I'm an athlete and I care about my sport, or because I want to set a good example for my siblings. I have a family member who struggles with addiction and I don't want that to happen to me. And what we hope by sharing all of those messages is that every young person who looks at it might find one of them and say, that's me too. I'm that too. And it's really powerful when they carry that message forward. So now we're looking to the future and thinking about how we can enlist those of you watching to help us and help these kids make a difference for the future. So Bob, I think this is you.
I thought you were going to do the slide there for a minute.
I'm not.
I want to thank all of you for listening to this. Before I finish here, I also want to say that the data that you've seen represents 5 years of work at IBH to pull together things that have never been pulled together in an entirely new way that has a great significance and power. All of that's published in peer-reviewed journals, professional places, and all of it comes from nationally represented data. So it's not some esoteric thing we've done, but something we've worked on for a long period of time. Nancy has been very generous in talking about how she came in 2017 and saw me and all these things happen. Well, I want you with us to see that the learning went in the other direction very, very strongly. What Nancy did was a game changer. This is not an IBH project. This is an IBH project with RyeACT and with Nancy, who has really been a leader and who's carried it and developed in ways that we never dreamt of. And also I point out that Westchester County is not irrelevant here. Westchester County was central to the parents' movement in the late 1970s and early 1980s. And it's happening again. You get not just a school or a school district, but in the entire county is alive with prevention. And the excitement that is there is really just phenomenal. And while I'm doing a little thank you here, I also want to thank a person who's not able to be with us right now, Corinne Shea, who's been very important to IBH, who just delivered her second child 2 days ago and can't be with us, but she's been very important in everything we've done. And then the last thank you is how I'm basically a treatment guy, and how in the world did I ever get into prevention and make this the center of my life? And the answer to that is my wife, Helen, who is executive director of IBH, and who kept hitting me on the head. And finally, I woke up one day and said, maybe she's got something there. And Caroline, my daughter, God bless her, who grew up with the drug issue, she's had it all her life and is now devoting herself to it. Well, that's very gratifying to me. So let me turn to the slide after those thank yous that are completely from my heart, and what a joy it is to me to be able to make this video and share this excitement with you. Okay, look to the future. The basic problem we have is what I've called commercialized recreational pharmacology. And that sounds pretty highfalutin and complicated, but it's really very simple. And that is that human beings have discovered a relatively small number of chemicals that have a very unique impact on the brain. And not just the human brain, animal brains too, but we're talking about its effect in humans. And that is they stimulate brain reward. They get the brain to say more, I want more of that. People like the drugs, and the animals like the drugs because of the brain biology. And it's turned into a business. It has both a legal side and an illegal side, but on both sides, it's all about money. It's all about giving people chemicals that they will like because of this brain stimulation, and then the users give the money to the sellers, and this creates industries, both legal and illegal. And they all have the effect of hijacking the brain and creating addiction and all the other problems that come from it. But I want you to understand that it really is a much larger problem than fentanyl or heroin or prescription opioids or marijuana or alcohol. It's really one big problem, and it's the use of recreational pharmacology, use of drugs for pleasure, and it's commercialized. And the money is really a very important part of it. Now, the second one down there is to really sort of get sobered up at what happened with vaping. It's very important that we went after cigarettes as a country for half a century and zeroed in on it like crazy and did a heck of a good job. And all of a sudden, it was turned upside down by a new delivery system, the commercialization of a new delivery system, vaping. And you saw what's happened with that. And the vaping is now also going into marijuana and other drugs because it's just a drug delivery system. It has nothing to do with nicotine. It's just nicotine is part of it. And the same thing is happening on the drug side with all these new drugs. I don't know how many of you recognize the fact that it used to be there were just a few drugs. Well, now there are hundreds of drugs. And there will be thousands of drugs going forward, because the inventiveness of humans to find chemicals that have this characteristic is limitless. There's no end to that. So you're going to see lots and lots of new drugs, lots and lots of new delivery systems, and all kinds of social, historical, economic activities around those. But it's one big problem. And that's what this is all about. And it's really important to understand that the use of chemicals that stimulate brain reward for pleasure is unhealthy. And if you can get that idea, and that youth is what it's really all about, that's where we can come together and really make a very big difference on. So that's what's going on here, and it's a revolution. It's a whole different way of putting things together, pieces together that reinforce all the pieces. As Caroline was saying, it's not competing. We're not competing with the Truth Campaign. We're not competing with the people who want to reduce drunk driving or binge drinking. Not at all. We're all together in this. But I just wanted to see the bigger picture in which all of the rest of that rests, you know, where it all is. Okay, let's go to the next one. Okay, final thoughts. I really want you to carry away from this a sense of hope, a sense of optimism. About thinking about the roots of addiction and recognize the biology of it, and recognize the resilience of human beings as individuals and in cultures. We can do this. We can do this together. And it's really very important. And to make this work, we want to focus especially where we don't have a lot of conflict. We got conflicts about adults, about using drugs, but we don't have any conflicts about youth using drugs. There's nobody who thinks that's a good idea. And I think that gives us an opportunity, some leverage to really make a big difference. And then also I want you to come away from this with the fact of who's really leading this new vision. And the answer is youth. It's very interesting. This didn't come from any scientist, certainly didn't come from us. It didn't come from some experiment that was done. You notice that trend started back there in 1978, 79. That's when the change came. And it came in reaction to what was going on with youth drug use. And it was undetected for 3 decades. Undetected for 3 decades. And what we're talking about here is looking at that youth movement, that incredible growth of the percentage of kids who are not using any drugs over the last 3-4 decades, and build on that. We don't have to create a trend. You don't have to conjure up something. We just have to recognize it and support it. And as Nancy did, give the kids the microphone. Let them talk. Let them tell why. Let them tell how it's working. How does it affect their social life? How does it affect their active life? How does it affect their home life that they've made a decision not to use drugs? That's a game changer. It makes a tremendous difference. I want to sort of show all of you this red band I have. This is my one choice bracelet. Wherever I go, including talking to you, I got this on because I think it's so important for us to stand together and to do this. Okay, let's go to the next one. So here is our organization slides. We have One Choice Prevention that we welcome you to come to, and also IBH, and Nancy's got the RyeACT things there. We want you to use this video. We want you to use these connections. Certainly use all the data you've seen. All of that's public. None of it is private. It's all accessible to you. And I encourage you to get in touch with us and tell us how you're doing, how we can support you. We want to join with you, the people who are watching this, and do what we can to support you. We don't have any commercial interest in this. We don't have any limitations on anything. It's all available to everybody. But we want to be part of a movement that is youth-led, that is going to turn things around in this country and offer hope and save a whole lot of lives and families, and make us all a lot healthier. And I'm just proud to be part of this operation. And I thank you all very much. So final words from the two of you. I'd like to hear from anything you want to say before we end here.
Bob, I think you said it all. I think the biggest thing is join us. Those are the words I say. My student leaders say it all the time. We finish almost everything with those words. Join us. It's about inviting people in, not keeping people out. It's about inviting people in to say, everybody can be a part of this, and we want you. And we're proud to be, we're incredibly proud to be part of it here in Rye, and grateful for your friendship and your guidance and your leadership, and proud to be part of carrying this really positive and empowering message for young people and for communities, for parents too. It's empowering for communities and parents to see when kids are making a healthy choice and what that does and how that changes communities over time. So join us, reach out, ask questions. Our contact information is there. Don't hesitate.
Caroline.
I'm right with you. Join us. Make sure you have a clear prevention message. Use the data and get in contact with us and let us know what you're doing. We can't wait to see what creative ideas you come up with.
Thank you all very much.
So with that, I'm just going to put this references and resources page up there, and we will share the slides as well so that folks who are watching can get access to those slides wherever we put the video. And I'm going to stop our share long enough to say thanks for being with us, and we hope to hear from you.